In this video, I'll be discussing about breast engorgement, that is heaviness during breastfeeding. So let's see what is breast engorgement first in detail. Breast engorgement in simple word means too much fluid in the breast, that is breast milk. How does an engorged breast feel? Engorged breasts feel heavy, full, tender and painfully hot. The first week after birth, sometimes if the mother faces challenges in nursing the baby, breast milk gets accumulated and develops breast engorgement. The other factors for breast engorgement are if the feeding schedule is delayed or the baby is not breastfed as often, you could get an engorged breast. Sometimes some mothers only feed one side of the breast, which causes the other side to engorge. So let's see how to manage breast engorgement. Immediate resolution for engorged breast is feeding the baby at frequent intervals and feeding your child as often and as long as your baby needs. Green cabbage is one of the most effective natural remedies for managing breast engorgement. Compress can also relieve engorged breast followed by hand expressing of breast milk. In case if the breast becomes too firm, you can use reverse pressure softening, which I'll be discussing now in detail. Crochet model of an engorged breast. Like I told you before, engorged breasts are heavy, full and tender. So I'll be teaching you about reverse pressure softening in detail. So reverse pressure softening has got 3 techniques. So the first technique is, place both your thumbs near the areola. Then start applying pressure. Make sure you apply only gentle pressure because engorged breasts are always painful and tender. Follow this step for nearly 40 seconds. If the firmness is more, up to 1 minute you can follow this procedure. By doing this, you can feel your firm breast become tender as the breast milk is discarded. So the second technique is similar to the first one, but just that you have to keep your thumbs horizontally and follow the same pattern. Apply gentle pressure near the areola, same as the first technique. Apply pressure. So for some breastfeeding moms, the tenderness is not present only near the areola. The overall breast there is a firmness and tenderness. So in that case, you can use the third technique by applying 3 fingers on either side, and you can apply the same amount of pressure that was told to you earlier. Make sure you gently massage. So reverse pressure softening is, imagine you holding a tennis ball or a laddu. You can place your fingers near the areola and you can start applying gentle pressure near the areola and twist. Gentle pressure and twist. Follow the same pattern for 1 minute. In case if you are having too much of firmness in the breast, up to 2 minutes maximum can be done in this technique. Make sure when you massage it gently. Like I told you before, breast engorgements are very painful. So follow this routine gently and softly. Of a normal breast and an engorged breast with sore nipples. So let's see the normal breast. So the inner section of the normal breast, if you see, these are the lobules. Lobules are glands that make milk. So here the lobules are normal in size, that is because of frequent breastfeeding. Engorged breast, like I already told you, engorged breasts are heavy, they are tender, they are painful hot, and the reason being is because of the delayed breastfeeding, and also another factors are because of the sore nipples. If you see the inner section of the engorged breast, so you can see the difference in the lobules. The lobules are enlarged. That is because the lobules are accumulated with breast milk because of delayed breastfeeding. So this is the inner section of a normal breast on the left and the engorged breast on the right. The last one is hand expressing of the breast milk and using a breast pump. In case if you're suffering from breast engorgement associated with severe pain, tenderness and fever for a prolonged time, it is best to consult a doctor.